E te hui, whae te maturanga kia marama, kia whae take nā mahi te katoa. Tu maia, tu kaha, arua atu, arua mai, tātou ia tātou katoa. For this gathering, let us seek knowledge for understanding, have purpose in all that we do, stand tall, be strong, and let us show respect for each other. Morena, good morning. I'm Chris Roberts, CEO of Tourism Industry Aotearoa. Thank you for joining our TIA webinar. We've had unprecedented interest in this webinar, obviously reflecting that these are unprecedented times. I'll just hand over now to our Advocacy Manager, Steve Hanrahan, just to outline how we're going to run things this morning.
Thanks, Chris. Kia ora and good morning, everyone, and reiterate Chris's welcome to our webinar this morning. You'll see on the slide in front of you the program for this morning. So we'll shortly hear from it's Chris Roberts, provide an update. We also have representatives from NB here as well, Richard Davies and Ian Southall. The Ministry of Health are on their way, so they were expecting them shortly. Each of the speakers will give a 5-minute update, and then we'll enter into Q&A. It's a half-hour webinar, but it may go past that. So just to let you know, it might run slightly after. We'll see how the questions go. If you do have questions, we encourage you to send those through. We've received some questions already from participants when they were registering for the webinar, but also encourage you to send questions through now, and you can do that via the Zoom program. Now, Chris, over to you.
Thanks, Steve. Well, just a quick wrap of where we see things currently from TIA's point of view, and obviously this is a situation changing not daily but hourly. For us, we've been operating in full crisis management mode since the start of last week. And even prior to that, of course, we were regularly meeting with officials and with government. One of those meetings, we suggested the setting up of a COVID-19 tourism action group, which the government did, and NB is leading that group, and that's proved invaluable in terms of making connections between government and industry. We've also set up a tourism panel that Steve's looking after, and that's met several times, and that's connecting with other associations and with industry leaders and getting us regular feedback in on what's happening out there in the industry. Because at the moment, communication is absolutely the key, and staying connected and ensuring that the flows of information are happening both ways, and that information is as correct as we can make it. It's really, really important that you go to the right sources for information. So that's the Ministry of Health for health advice. It's business.govt.nz for advice on the government assistance package and how to apply for the wage subsidy and so on. It's the brand new website, covid19.govt.nz for everything COVID related. And it's TIA's website. We've got sections there on the actions that are underway and advice and support for members. So please go to the right sources for information, and there is information there to assist. I won't talk at length about the government support package because we do have senior MB officials here, so thank you very much for them joining us. You'll all be aware, I hope, that Trends 2020 has been cancelled, and we've got a team working hard on that with our insurers to wrap that all up as rapidly as we can, and to be in a position to be able to give those who are attending what will be, I guess at this point, a very welcome return of some cash. Can't promise yet when that will happen, but we're working as hard as we can to wrap things up for Trends 2020, and of course doing some thinking about Trends 2021. we've got lots of questions from the industry, lots of issues that we're dealing with, and just as a couple of examples, self-isolation remains an area that we know people are incredibly interested in, and we have Ministry of Health and other officials here to help advise us on that. That's both around what information is going to travellers when they arrive and what should be happening with travellers that might be turning up at your businesses and how that should be managed and what you should be saying and doing. I know there's a lot of interest in domestic tourism and whether we might get some domestic tourism this school holidays coming up in Easter. We've also done a lot of work in the last 48 hours on support for medium to large businesses. I think it's acknowledged that the government package is certainly very welcome for the smaller businesses. And again, yesterday the government talked about dealing with larger businesses on a case-by-case business. So we've compiled a lot of information and fired that through to the government on the impact that we're seeing on larger businesses and trying to get conversations going on what can be done to support them. And mental health support we still think is incredibly important. We know this is an amazingly stressful time for everyone. We've got some information, we've got a very kind offer from the mental health support service that we'll be providing out on some free online services that they've offered to all TIA members. And we're having a discussion instigated by the CEO of MB next week with some senior tourism leaders about what needs to be done over the coming weeks and months to support our industry through the mental health impacts of this event. So TIA is your voice. Please keep supporting us. Please stay in contact. Forgive us the occasional misstep because we won't always get everything right, but we are here. We've got the communication channels open. There'll be more webinars like this going forward, reach out when you need help. Kia ora.
Great, thanks, Chris. We're next going to hear from MB Tourism about the government's economic response package. So over, Richard, to you, Richard Davies. Welcome.
Thanks, Steve. I'll just introduce myself, and I won't talk for long at all. So I'm Richard Davies, General Manager of Tourism at MB, and I've got two of my colleagues here. Got Ian Cossar, who's the General Manager of COVID within MB, and I've got Ian Southall, who's Director of Policy in the Economic Development area. And between the three of us, we should be able to cover off a bit of stuff. The only context I wanted to put around this from a tourism perspective is obviously this is a global event and a global disaster for tourism, if you like. So it's important to bear that context in mind with how the government's approached this. It's also obviously has implications right across the economy and society. So that's all I wanted to say. I don't know, Ian, whether you want to add anything by way of introduction. Otherwise, we can pass to Ian.
No, maybe come back.
Great.
For the broader outlook, I think.
Okay, well, I'll pass to Ian, who's been the one really leading this business support package from within MB.
Thanks, Richard. Kia ora, everyone. Ian Southall here from MB, as Richard says. Maybe I'll just talk a little bit about process, and then also, I don't know if we then want to start ripping into questions or whether you want to go to health first. So thanks very much. We've got some questions in front of us, and as you can imagine, our colleagues at the Ministry of Social Development and ourselves are fielding a number of specific questions around the wage subsidy scheme and the leave payment scheme. So what we are attempting to do, and this resource that I think TIA has set up we're gonna feed that into it, is that we are getting very specific questions and general questions. And what we are attempting to do through this process is have regular updates onto the website, so that the frequently asked questions on MSD and biz.gov are getting updated daily as we sort of group together some of the generic questions we've got around the the wage subsidy, and then on the leave payment stuff. I think maybe the only other comment that I would maybe make is that, as Chris Roberts said, bear with us if we could make a plea on that as well. Officials have been working pretty fast on both the wage subsidy scheme and the leave payment scheme. And I think it's fair to say that in a number of our careers, the speed with which we are working on this space and the magnitude of the policy changes we are putting in mean that there are some things that we are getting questions about that we need to address to provide as much certainty going forward as we can. So keep the questions coming, and we will attempt to address them as much as we can.
Great, thanks, Ian. Now I'd like to welcome and introduce Harriet Carr from the Ministry of Health. Welcome, Harriet. Over to you.
Yep, kia ora, thanks. So I'm the Deputy Director of Public Health at the Ministry of Health, and so Health has been leading the response at the moment, but now of course we've got the all-government approach at the moment. So I've been asked to talk about self-isolation, and I think I'd just like to really reiterate what's the purpose of this, for this, and technically from a health perspective, it's actually self-quarantine. You isolate someone when they've actually got a disease, and quarantine is actually when someone's, we think someone's at risk of developing a disease. So unfortunately WHO came up with self-isolation at the start, so we're sort of stuck with it, but it's going to cause confusion going forward when we put cases into isolation, because that's strict isolation. So in theory, this is actually self-quarantine is what we're calling it, what it should be called. But having said that, we're stuck with the moment with self-isolation. So these, so these are people, particularly, you're most interested in is people coming in from overseas and the requirements on them. We also have another group, close contacts of confirmed cases, who we see as a higher risk of developing disease. So we've got some sort of looking at stricter quarantine measures around them. And then there've also, if you have confirmed cases in a setting as well. So there's sort of 3 different groups to consider. The bulk of the people from the tourism thing will be in this first category of people who've returned within the last 14 days. And as you've seen with the worldwide situation, the main reason for that is, with the exploding number of cases internationally, is we have to treat all of these people as potentially at risk of potentially that they could be incubating the disease. The incubation period has been given as sort of 2 to 14 days. So hence why we're saying asking them to self-isolate for 14 days after they leave the country. So it's not from when they arrival, it's from when they leave that country. Because the evidence suggests that people are most infectious in the early stages of the illness. So that's when they've only got the very mild symptoms. And sometimes if you've travelled overseas, sometimes you're feeling tired anyway. It's quite hard to recognise actually that you're coming down with something, or are you just jet lagged? So it's really hard to, sometimes you don't really know. You think, oh, maybe it's just because I've flown, or it's been quite a stressful time. And so it's quite hard sometimes in those early first 48 hours or so to actually know whether you're definitely sick or not. So that's why the self-isolation allows for that. Someone not being sure, allows for that sort of area. There's been a few reports of people who remain totally asymptomatic without symptoms, but that seems to be relatively small. The testing out with the cruise ship suggested that most of those people who initially were reported as being asymptomatic actually developed symptoms after the testing, so they went on to develop symptoms. So that reinforces this self-isolation approach where we're not sure yet whether someone is infectious or not. Some of the questions and things what our advice is really saying is come into the country, do what you need to do to get to your place where you're going to self-isolate, minimising your contact as much as you can, and then stay in the one place for 14 days. We've had questions about people wanting to self-isolate in a different hotel every day, or to self-isolate in a hotel for a couple of days and then move to a camper van. From a health perspective, we've already got a reasonable number of cases, and they're just coming in thick and fast. What's been really easy, we've had one where they came in, they drove their own car to their sleepout, and so there's no, and then they were sick, they developed illness on just as they were coming back in. It makes it so much easier for us because the only contact tracing we have is the flight. Then we've had others who have ignored things. They've been symptomatic and they've gone around the community, and then you've got 150 close contacts that you're following up and putting into isolation for 2 weeks. And that's where, from a public health perspective, that's a huge resource for us, and also the risk for transmitting it further. So the minimal contacts that we can have for that person to get to one place and they can stay there, the better. Now, I know there's been questions around like camper vans and issues around that. Provided they stay, and it's a fully self-contained, it's got to be fully self-contained camper van, and they can keep away from other people and not use any public facilities, then that would be acceptable. But really, we really want to emphasise that they need to really try and keep away from other people. I signed a letter on Monday, which is Special Powers and Medical Officer of Health. So that basically means that under Section 7A of the Act, Section 70 of the Act, that we can require people to be quarantined, so if they don't obey it, and it also gives police powers to enforce that self-isolation. So the police have the powers to do what they need to do to encourage that person to follow our advice. Now it needs to be proportionate to the thing, and you need to also make sure that the person actually understood what the requirement was as well, rather than just go, you have to give them a little bit of a benefit of the doubt. And Susan, we've been looking at also, you might want to talk about the measures in terms of how people can dog people in.
Oh yeah, so I'm Suze Halligan, also of the Ministry, and so I'm working on the self-isolation and quarantine facility type situations, and we do have a process we're just setting up now, and that's it's a non-compliance sort of coordination cell, so a notification cell, and that non-compliance cell will be set up to receive anyone that wants to dob in someone that they know is not abiding by the self-isolation procedures. So at the moment, I think people are going into Crime Stoppers and into Healthline and into the government helpline and whatever line they can find to ring into. And we have an email address at the moment that those lines can be pushing that information to us, and we'll triage that information, decide if it's a close contact or a case that's not abiding, then we're going to obviously get our public health units to address that, and or if it's a low risk traveller that's come back and they're just going down to the supermarket or whatever, we can address that and then have a enforcement person, it's not necessarily an officer, just visit that person to be able to see what's going on. And we've already got checks going in place at the moment. Police are going around doing checks on a regular basis each night. They go around and do a whole bunch, 50 at the moment each night, just to see whether people are actually abiding by the self-isolation.
Is there a preference for tourism businesses who might be concerned that an overseas visitor is not obeying the rules? Is there a preference for which channel they use? Is it Crime Stoppers, or does it?
Yeah, so at the moment we haven't confirmed which one we want as that, but we will come back to the agencies. At the moment, just use whatever one that you think is appropriate, and in the meantime we'll get that communications out so that people are aware how they can do that more effectively.
That's great. Okay, well, thanks very much for that update from the Ministry of Health. So we're now going to move into the Q&A section of the webinar. So I see there's lots of questions coming through, so thank you for those, and keep sending those. And note that this is where I'm unlikely to get through them all, but we'll certainly post the webinar. We'll be drawing out the main themes and then providing information back on those through the likes of our website. But let's kick in now to some of the questions that we do have. Chris, I might just start with yourself. Does TIA have recommendations with how to handle existing bookings or cancellations?
Look, in the initial stages when this was kicked off as a China-only issue, the advice was to be as generous as you can and think about long-term relationships and keep those long-term relationships going. The scale of this is now at a point where, really you have to, you have to abide by your terms and conditions. The only thought is the relationship you have with the other party that you may now be involved with having to cancel that booking. So still try to think about your long-term relationship and whether that being flexible and generous is going to help you with that. But no one is expecting people to go over and above, and you have to protect your businesses. Your terms and conditions say no refund available, then apply your terms and conditions.
Great. Thanks, Chris. Ian from MB Tourism. What if the business is not eligible now for the wage subsidies based on current revenue and forecast revenue is not down below 30%, but later the situation gets worse? Can we still apply for the government subsidy and still receive 12-week subsidy?
I think the answer to that is yes.
Okay, great, thank you.
So just to remind everyone, the applications opened or applications started to be received on Tuesday, the 17th of March, and we'll be open for the 12-week period, which gets you to mid-June. The other thing, just a general comment on both the schemes, which sort of tend to address a number of the questions. The principles that are set out for both of these schemes are what we call high trust. So effectively, as you will see on both the application forms, government doesn't do this sort of stuff very often, but you will notice that the application forms for both of these schemes are exceedingly light. And the rationale for that is that we are trying to get money out as fast as we can. And the other observation we would make is that in the circumstances where we've had to put in emergency business support in the past, for example, when we've had earthquakes and the like, our observation is that New Zealanders use the intent of the policy pretty well, so that we are able to have that level of trust in the model.
And can I just say, Chris Roberts here, applaud the government on doing that. In the discussions, we were able to have some input into the design, and we said that, yes, a high level of trust scheme that got cash in bank as rapidly as possible was what was needed. Now we need the industry now to play ball, and I'd be appalled if there were exaggerated or fraudulent claims put in. This is a very high level of trust. It's relying on the people being honest in their applications. So, let's meet that bar.
And as you've seen with with individuals, particularly foreigners not following self-isolation rules, the government will look for and take chances to scapegoat and come down real hard. So they'll work at both ends of the regulatory system where we're basically light touch, but if we find and can enforce, we absolutely will, and we'll do it ruthlessly. So it's really important that money flows to people who are intended to get it.
Great, thanks Ian. That's Ian Cossa, who's with us also today. So we've got two Ians plus Richard from MB Tourism there. A question for the Ministry of Health. If our accommodators have a guest that falls ill while staying at their property, what is the process or procedure that they need to do?
So it depends, I guess, on the setup or the accommodation setup, but basically, they should try and immediately isolate that person and separate that person away from others, except if they're, a family unit, then keep those, but keep them away from other people. Make sure that person has contacted Healthline in terms of to get the advice, and it depends on the severity of their illness as to whether they end up being swabbed or whatever in a general practice or in the hospital. And we're setting up community-based assessment centres as well at the moment. So that's the process in terms of making sure that person has contacted Healthline. And then again, it depends on the situation. So if they're in a hotel or a motel, it's a bit easier just to, make sure that they advise them to make sure that they stay there. And, you might be able to support them by phone to, look at where they can order food in or that, to make sure that their welfare needs are met in the interim while they're in that sort of phase waiting to find out whether their test result is positive or not. So what we're recommending is once someone's been tested, they should be, while they're waiting for the result, they need to be self-isolated and whoever's with them should also stay self-isolated. So the rest of the family or whatever shouldn't be going out as well while we're waiting for the test result. And then, it depends. If they're in shared accommodation, that's a wee bit trickier. So backpackers or something, it's doing as best as you can to isolate them. And then working with the public health unit to look at whether there's more suitable accommodation, or there might be a more suitable place in the campground or something that they could be put away from other people, which is self-contained in the interim at least. So it's,
And I believe the advice we've had previously in terms of cost of that movement of them just comes at a cost, then it's the customer who has to meet that additional cost.
Yes, at this stage, yeah.
All right, thanks there. I'd also just like to welcome to the webinar today a couple of representatives from IRD, Mark and Rata, who have joined us today. So welcome, good to have you here. A question for the IRD. What happens with contractors or employees on as required contracts? These people often work multiple jobs for different employers. Who applies for funding for them?
Yeah, so I think it's a little bit difficult one for us to answer because I think we just need a little bit more information pertaining to it.
Yes, right.
What I would say is if it's wage subsidy, then I would direct them to work and income. They're on their website, they've got a lot of information around what they can do and what support can be provided. The other thing that I would say in a broader sense from an inland revenue perspective is that if you're wanting to know more information, because I understand we have another one around tax implications, is that we are working through what it means as a result of the announcement that was made in terms of the business continuity package. So we've got a lot of people working as quickly as we possibly can to get some certainty. So once the legislation has passed, we'll be in a better position to come out and advise people around that.
Right.
Can I just make a comment on that? I guess that specific question and question more generally is that the wage subsidy scheme that is deliberately set out for employers, contractors, sole traders and self-employed people. So we have made, in the design principles for the scheme, we have made it available to everyone to apply.
Right, thanks Ian. Chris, one for yourself. Is TIA lobbying for larger size hospitality and tourism businesses to receive greater immediate funding from the government?
Absolutely. We went out to our larger members yesterday and asked what sort of situations they were facing, and we got sort of overwhelmed by the response. So we provided a very detailed spreadsheet through from 65 businesses who provided us confidential information very rapidly. And look, across those 65 businesses, there were 5,000 immediate planned job layoffs, and a third of those businesses were planning to close and another third were planning to partially close. And most of those actions happening within the next fortnight or so. So it was pretty dramatic news, and the government has, as we've said earlier, has signalled one-on-one discussions with larger businesses. That's going to be, I suspect, quite difficult because there could be a lot of people wanting a lot of discussions. There's certainly signal that more is happening in the larger business space, but we have to be realistic that the government cannot save every business. There are going to be businesses closing. And when I say closing, I think most of these businesses are thinking, I'm shutting the door now, I'm having to let all my staff or a lot of my staff go, but when this is over, I certainly want to be reopening the door. So it's not winding up the business if they can manage things like rental costs and asset costs as well, which will be a discussion with government on managing those fixed costs that still carry on after you've closed the door. But businesses want to come back, absolutely. So I think that's going to be, as we develop this, that's going to be one of the focus. A business may have closed. What do we do to ensure that it can reopen again when the time's right?
Great, thanks, Chris. Question for the Ministry of Health. Recommendations, do you have recommendations for airport staff, coach drivers, taxi drivers, etc., still needing to move visitors and people around with no protection?
Yeah, so this has come up quite a bit. It's interesting with the no protection thing. So we don't generally recommend masks because they're not that effective, and most people don't wear them. As soon as they get wet, then ineffective. And the main benefit of masks is they stop you putting your hands in your mouth. So and that's where we know is one of the key ways that people can get infected. The average person touches their face 25 times an hour. It's really one of the best things you can do is be washing your hands really well, washing and drying your hands and keeping your hands away from your face, because the virus gets in through your eyes, through your nose and your mouth. So if you can avoid rubbing your eyes, touching your nose and washing your hands before you eat, that's going to be your best protection there. In terms of then the other thing is really that physical distancing, so trying to maintain where you can, especially if you're in a detailed conversation with someone, trying to maintain that distance. I mean, just in passing, that's fine, but maintaining at least 1 metre and 2 metres is even better. So the further you are away, the less the risk. For taxi drivers, they're a little bit more. For coach drivers, and that often the person's just passing you briefly, and so the contact would be only a bit casual contact. So that's not so bad. Taxi drivers are a bit closer to a person. So some of the steps that they can really take is make sure the person's sitting in the back seat, maybe if there's just one person in the back passenger seat or furthest away from them. So in terms of that physical distancing, making sure that your aircon isn't on recirculate, so that you've got fresh air coming in, and if the person's coughing, won't get all the windows down, let the air circulate as much as you can to reduce that, and also asking them to make sure that they cough into their elbow or down their top, or covering it in terms of, because coughs and sneezes spread it further. So those are just some of the things that they can take, and then you can also have some disinfectant wipes or disinfectant that you can just spray, particularly on the door handles or things, commonly used things, after someone's used it, just to give it a quick wipe down, and that'll kill the virus as well.
Great.
Just to clarify, so those are really good bits of advice and apply to people who might be in the process of self-isolating.
Yeah, so that's on their way to being self-isolated. Yeah.
If we get community transmission, are those sorts of requirements likely to be general requirements for dealing with all contact?
Yeah, I mean, we're working through the next stages in terms of what does that look like, and we've been asked to basically prepare for what would it look like in 2 weeks. Now, if you look at what Italy, where it was 2 weeks ago and where it is now, these things, the situation could change very rapidly here, and so certainly the technical advisory group's meeting tomorrow to look at that, really look at our planning, and it's just got up on stuff too, some of the planning documents, you might have seen that. So looking at potentially 38,000 deaths in New Zealand. So if this comes, everything will be, if we get to that stage, then everyone will be self-isolating at home potentially. So it's really taking as many precautions now so that we can try and hopefully not be another Italy.
Great, thank you. I'm mindful of time. We've gone over the first half hour. We have many questions that are unanswered. We have over 550 participants on the webinar this morning. So we will aim to finish in about 5 minutes or so, but we'll just take a couple more questions. But just to let you know that we will work on making responses to these questions, and also we plan to run further webinars, and more information will be provided about that. Chris, just a couple final questions. Chris, has TIA managed to convince the government to allow Tourism New Zealand to advertise to New Zealanders?
No. No, sorry guys, Ian Costa here. This is a health issue. We are encouraging New Zealanders to maintain an appropriate social distance. We are considering what large gatherings of people look like and the risk that that pose to our health. Encouraging domestic tourism at this time, I regret to say, is not on the agenda. Probably the reverse. I really am sorry.
Yeah, and I back Ian up on that. We're not expecting anyone to be actively promoting domestic tourism. There are some promotions at the moment to support your local business, so that, you know, while you to be spending your money locally still, and not just in panic buying at the supermarket, but just general support of local businesses. But where domestic tourism will play its part is in the recovery, because clearly when we're through this, or at a stage through this, the first recovery will come from domestic. And whether Tourism New Zealand's involved with that or not is something to wait and see. But that will be the first place that we can get moving again, is domestic tourism. It will take time to ramp up international because there are no planes flying, etc. So yeah, no encouragement of domestic tourism at the moment. As yet, there's no ban on domestic tourism, but that remains a possibility going forward. But domestic tourism will have its place in due course when we in the recovery phase.
Great, thanks, Chris. A question for the Ministry, Harry. What are the border check processes?
Do you want to answer?
Yeah, sure. So what's happening at the moment at the border is, as the travellers are coming through the border, they are immediately seeing signage and cards and things for them to understand about the requirement for self-isolation. They have health officers meeting with them at the border, whereby they are provided their card that they need to fill out, and the cards are in the process of changing in regard to the arrival cards, but they have some cards to fill out that will ensure that they identify the residents that they're going to be self-isolating in, and also they go through a health check in regard to, are you unwell, how are you feeling, and working out whether there's someone that needs to be taken off to the side and more robustly looked at. If they are well and they continue on, our health officers are ensuring that they are having that opportunity to understand what self-isolation procedures are, and this process and the communications around this are improving all the time, and as we're developing and moving on in this area. Then obviously they'll see more signage, and then they'll move through some more the normal immigration checks and the like. So that's pretty much the process, I think, fully at the border at the moment.
Right, thanks very much. All right, we might just draw it in to a close now. Before I ask Chris to make some closing comments, just to firstly say thank you to everyone for calling in and coming on to the webinar today. Listen, we've had a very strong response as we expected, and we're certainly mindful that this webinar series, it is a series, that there will be more to come. Thank you for providing all of your questions. Thank you also to our speakers and our presenters who have been here today from IRD, from the NZDT Tourism, from the Ministry of Health. We will work on the format for the next webinar. Listen, to our members, if you have any views on who you'd like to hear from, we'll certainly get insight from the questions, but if there's someone you'd like to particularly hear from, then please let us know. Just reiterating also where to go to for further information. Chris had mentioned those, the Ministry website and others earlier on. Certainly at the TIA website, www.tia.org.nz, we have a lot of information on COVID. There are TIA's actions and responses, but there's also a specific page on advice and support for operators and travellers as well. So I encourage you to go there, and you'll find information and links to a lot of what we've been discussing today as well. So Chris, perhaps over to you for any closing comments and closing karakia.
Look, thank you everyone for joining. Had some immediate feedback on the earlier comments about what to do about cancellations and refunds, and I'm told that inbounders are in general waiving terms and conditions for book business and providing no cancellation fees and refunds. So that's fantastic that they're doing that, and they're very well aware of the long-term relationships that they've built up over a long time. So there are some very good decisions being made by people to try who are still thinking long-term about we will emerge from this, and you know, some of the behaviour shown now will be remembered later on. So if people are able to do that, and that's fantastic. We would all like to be at it. I'm sure a lot of people might have liked to have heard today about when this is over and when's the recovery. There's just scenarios at the moment, and a lot of the more positive scenarios have disappeared each day as we've gone along, unfortunately. But there is no return to normal. This will be a new normal. It's not, we can't wind the clock back and we'll be back to where we were. Whatever we come out of will be a new tourism industry, a new way of global travel. Everything's changed. And so we would all hope for the recovery to start within months. We would hope that it starts this year. We would certainly hope we're underway next year, but we just don't know. We've got to look after each other and at the moment and keep well informed and do what you can for your businesses and your people. But thank you for attending, and we'll stay in touch with you best we can. Kua mutu a mātou mahi mō tēnei wā, manaki tia mai mātou katoa, o mātou ho, o mātou whānau, ai o ki te aorangi. Our work is finished for the moment. Bless us all, our colleagues, our families. Peace to the universe. Kia ora. Kia ora.